In a webinar, a slideshow appears. On the title slide, Youth at Risk of Homelessness, YARH, Colorado Department of Human Services, Division of Child Welfare, Pathways to Success, March 2, 2021. Welcome. We are glad you are here. We will begin shortly. On the left of a white banner at the bottom of the slide, colorful blocks and slanted red lines form the logo of a house with an A-frame roof. Beside the logo, text in light blue reads, Child Welfare Information Gateway. On the right side of the white banner, a logo of 3 people in profile with the words Children's Bureau in dark blue. Pathways to Success, March 2nd, 2021. Now, Brunette Jen Vidrine appears in a small chat window at the top right of the screen.
Hello, everyone. Thank you so much for joining us today. My name is Jen Vidrine. I'm with Child Welfare Information Gateway, which is the information service of the Children's Bureau. For those who attended our last webinar, welcome back. For those who haven't so far, this is our webinar series focused on the Youth at Risk of Homelessness grant cluster. This is the second one we've done. Today's presentation, we're going to be focusing on Colorado's Pathway to Success program. We are so glad you're here. We want to go over just a couple of housekeeping reminders before we jump in.
A slide titled Housekeeping.
All right, so just so, as I'm sure you've all recognized this point, everyone's gonna start up automatically on mute throughout the presentation. If you want to ask questions throughout the presentation, we are going to pause after major sections and give folks a chance to ask questions using the Q&A feature. That feature is found at the bottom of your screen. It's a box with an arrow pointing upward. Oh, I'm sorry. It's two quote boxes at in the middle of your screen. And you're going to be able to use that throughout the entire presentation, so you can just type in a question. We do have folks from our team who will be answering questions along the way, but we may save some of them for the larger audience to be answered live. And as a reminder, all materials from this presentation will be sent out following the end of the webinar. So you'll receive an email if you attended today.
Youth at Risk of Homelessness, YARH, Grant, Catherine Heath, Child Welfare Program Specialist, Administration for Children and Families, Children's Bureau. Please note, YARH was a one-time funding opportunity for selected demonstrations.
Great, thank you so much, Jen. We are thrilled to have you here for our second of the Youth at Risk of Homelessness grants. As Jen mentioned, my name is Catherine Heath, and I'm a Child Welfare Program Specialist here at the Children's Bureau. We're the agency that funds services from prevention to adoption, including youth-related services. So I'm going to provide a little bit of an overview of the Youth at Risk of Homelessness grants and how it fits within the Children's Bureau's portfolio. So the majority of our funding is mandatory programs here at the Children's Bureau, but we do have a small pot of discretionary grant money where applicants can apply through a competitive peer review process to basically try out or test new innovations. And in many ways, our discretionary grants, like what Colorado has done, operates as a learning lab in the field. So really trying out without risk new processes to be able to best serve populations served by child welfare. And it's often because of this innovative work that we learn how to best do the work. And many of our practices that are now standard in child welfare were developed through discretionary grant work. I think a great example of that is early work and research around kinship navigation and kinship services. So over 10 years ago, we had a concern thinking about youth and young adults with a history of child welfare involvement and knowing that they face significant challenges in their transition to adulthood. So we developed a set of discretionary grants to really build the evidence base of what works in preventing homelessness among youth and young adults who have child welfare histories. This became the Youth at Risk of Homelessness, a multi-phase grant, and we're now at the tail end of this work, and so we're sharing with you our lessons learned. So YARH was one of many federal initiatives focused on reducing youth homelessness. There's the HUD Youth Homelessness Demonstration Grant, 100-day challenges, and any number of other pieces of work done by federal agencies to really look at ending youth homelessness. But YARH was unique in the fact that it was solely working with solely preventing homelessness among youth and young adults who've been involved in the child welfare system. So therefore, it was funded a little bit differently. We funded it in order to build capacity in communities, and Colorado is going to talk about that in a minute, and then fund a subset of those grantees to really implement an intervention that we could hopefully evaluate and then lead to increasing the evidence base of what works in child welfare, which we know is an important task of really building the evidence base and really for young people who are transitioning out of foster care. So before I pass it over to Colorado to talk about the work that they've been doing for 6 or 7, even 8 years at this point, I just want to remind folks that this is a one-time funding source. So YARH funding is no longer available at this point. And so what we're sharing for you is actually our lessons learned around this one-time funding source that represents the Youth at Risk of Homelessness discretionary grant. So with that, I want to thank you so much for attending, and I'm going to pass it over to Lene in Colorado to talk about their work.
Bespectacled Lene Davis, Pathways to Success, Colorado's intervention to prevent homelessness among youth aging out of foster care.
You can go to that next slide. Thank you for joining us today. My name is Lene Davis. I'm the lead evaluator from the Center for Policy Research. I've been involved with the YARH project since phase 1. Trevor?
Brown-haired Trevor Williams.
And I am Trevor Williams. I'm the Youth Services Administrator for the Division of Child Welfare with the Colorado Department of Human Services, and the Project Director for Colorado's YARH project, Pathways to Success. And I've been involved with the grant since the very beginning of phase 2. Christy?
Wearing face masks, Christy Townsend and a teenage boy.
I'm a Pathways Navigator from Boulder, Colorado. And I am actually joined with one of my youth that I will give it over to.
Hi, I'm Christopher Horton, and I am a previous Pathways youth, and I'm still working with Christy sometimes. So,
Thanks.
Next slide, please.
Today's agenda: overview of YARH, Pathways to Success, intervention and formative evaluations results, questions and answers.
First, we're going to provide a brief overview of the Youth at Risk of Homelessness grants, known as YARH. Next, we're going to provide you with a description of the Pathways to Success intervention developed by Colorado and share results from our phase 2 evaluation. And then we're going to provide you with insights from the Navigator and youth relationships work from Christy and Chris. And then finally, we'll end with a Q&A session and share additional links with resources that have been developed from this program. Next slide.
About YARH.
So first, what is YARH? The Children's Bureau started a multi-phase grant program in 2013 to build evidence on what works in preventing homelessness among youth and young adults with previous involvement in the child welfare system. The grant program and related contracts known as YARH, Youth at Risk of Homelessness. Colorado was awarded a planning grant in 2013 under YARH and an implementation grant in 2015, which was our YARH phase 2. So locally, our YARH program is known as Pathways to Success, or Pathways for short.
Motivation for YARH.
So before we dive into what YARH is, let's talk about who YARH aims to help. Youth and young adults with child welfare experience who are most at risk of homelessness. Many of you know that approximately 20,000 to 23,000 youth age out of child welfare every year. States have the option to extend the federal program to age 21 and even to continue to provide services up to age 23. But we know there's a great disparity in the outcomes of youth exiting from foster care. The Children's Bureau is currently focused on promoting and supporting communities and other in prevention of child abuse and neglect. We know that many families, when provided the concrete services and supports they need, have the capacity to provide for their families. Foster care should be the last resort, and we must, in all possible circumstances, support kinship and relative caregivers in providing care and support for children who cannot remain in their homes. Finally, we know that youth do the best in family-based settings where foster care is a support, not a substitute for parents. Far too many young people come into foster care because their families do not get the services they need. Even when foster care is truly a last resort, we know we still have a need for placements. We know that while some young adults will transition successfully into adulthood, some young people, particularly those who experience multiple placements, group homes, and run away from foster care, are at additional risk of homelessness. The purpose of YARH has been to change the relationships of responsibility that child welfare agencies have when preventing homelessness. According to NIDED, at age 19, over half reported some employment-related experience. At 19, 57% had received a high school diploma or GED, and 52% were enrolled in attending an educational program. 89% of youth had a positive adult connection at age 19, and data from cohort 2 of the NIDED at age 19 supports the fact that youth continue to struggle, but they're promising signs of early independence and stability. However, some young people who are leaving the child welfare system, perhaps with limited skills and support systems, have outcomes the child welfare system must be responsible for preventing. Only 50% of youth who age out of child welfare have gainful employment at age 24. We know many young women are young parents. A quarter of them suffer from PTSD after leaving the child welfare system. And according to the National Youth in Transition Database, 19% of youth formerly in foster care were homeless in the past 2 years. Additionally, 36% of homeless youth report having been in foster care at least once. YARH offers an opportunity to learn even more about how to help youth and young adults with child welfare experiences. Grantees have focused on both youth who are in care and youth who are no longer in care.
YARH goals.
Next slide.
YARH has two main goals.
YARH grantees and the contractor accomplished many things as part of our YARH work. However, there were two clearly stated goals. The first was to develop a comprehensive service model to prevent youth and young adult homelessness. And the second was to test that comprehensive service model to build evidence to support them.
Where is YARH? On a map
Next
of the
slide.
US, several states are filled in with
where
dark
is
blue.
YARH? This map shows the 16 states in which child welfare agencies or similar organizations received YARH1 and YARH2 grants. Grantees were represented in all phases by state child welfare agencies, county child welfare agencies, tribal child welfare agencies, and community-based organizations that were spread across the country.
Focal populations and outcomes.
Next slide, please. There are three focal populations for the YARH work. The first, adolescents who enter foster care between ages 14 and 17. The second, young adults aging out of foster care. And third, homeless youth or young adults up to age 21 or 23 with foster care histories. We're focused on 4 critical outcomes identified in the USICH Youth Framework, specifically housing, permanent connections, education and employment, and social emotional well-being. During YARH1, grantees focused on collecting and analyzing data in our communities to understand these 3 populations. How many youth and young adults were there in these populations? What were the risk and protective factors associated with homelessness? Were there unmet needs? What did the youth or young adults believe they needed to have different outcomes? And in YARH2, we are conducting initial implementation of our comprehensive service models. Some grantees moved forward with the original comprehensive service model planned in YARH1, and others reassessed their community needs and shifted their service models in some way due to implementation challenges or findings from our usability tests.
Progression of phases 1 to 2.
Grantees are conducting usability tests where we set benchmarks for very concrete and specific elements of our comprehensive service models. And then based on that data, we decided whether to tweak the element or not. Over the last few years, we learned about how to identify, recruit, engage, and retain youth in the intervention, some of which are a year long. We're learning about providing the actual services, including challenges with staff, such as staff leaving or not embracing the new practice. And finally, we're building evidence about the effects of the new services on youth in our communities. We know that building evidence takes time and is an iterative process. And due to the lack of evidence-informed or evidence-based programs for youth aging out of foster care in general, and specifically that focus on the outcome areas of interest, most of us started below the bottom bar or intervention description. I think you.
YARH focuses on building grantee capacity to do the work.
Sorry. So can we go back one? Sorry, Jen. All right, here. So as previously, I want to go back to the 3 phases, sorry. As previously mentioned, there's 3 phases to YARH. In phase 1, 18 communities received funding for YARH phase 1. Communities were given 2 years to identify those 3 target populations in our communities and learn the needs of each population to prevent future homelessness, and then develop a comprehensive service model that would meet those needs and thus prevent future homelessness. Phase 2 funded 6 of those first 18 Phase 1 communities for an additional 4 years to focus on initial implementation of those comprehensive service model and to conduct an evaluation to produce evidence of outcomes and work towards participating in a summative or impact evaluation. Finally, Colorado was funded through a contract with Mathematica for Phase 3 to conduct a summative evaluation of our Pathways Comprehensive Service Model. This summative or impact evaluation will compare outcomes for youth who receive the Pathways intervention to those youth who receive typical CHAPI services provided across the state of Colorado. Next slide.
A list of YARH products.
How will we continue to learn? ACF and Mathematica plan to continue to share findings and lessons from the YARH work. The products on this slide are planned, so watch for them on the OPRI website. And in addition, Center for Policy Research has a Pathways to Success page on our website that provides links to download the Pathways specific reports that we have produced over the course of our work with YARH. And a link to our website will be shared in the chat and also later in the presentation.
What is Colorado's Pathway to Success intervention?
So with that, I'm going to turn it over to Trevor to talk about our Pathways, Colorado's Pathways to Success intervention. Trevor? Unmute yourself.
Trevor Williams.
That would help. It would be a Zoom meeting without someone forgetting to unmute themselves. Thank you so much, Lene. Can we go to the next slide, please?
Pathways is innovative and youth-driven.
So we're going to talk a little bit about what the Pathways intervention is and some of what it entails.
A donut chart.
As you can see from this slide, the core of the intervention is the Navigator at the center. And the Navigator is meeting the youth where they are while walking alongside them using a model of engagement that we call coach-like engagement. Coach-like engagement is based on the coactive model of coaching and assumes that the youth are creative, resourceful, and whole individuals who are capable of identifying and advocating for their own needs. The coach-like engagement model is meant to be youth-driven. So as the Navigator is working with the youth, it drives all of the things that you're seeing in the second ring. So when you're looking at this, we're seeing planning and assessment tools, crisis stabilization, goal setting, warm referrals, and all of the other things there. How those are used and what is used within those is really driven by what the youth needs based on the youth's goals. This is really all about the youth's hopes and dreams. And by working with the youth from the place from where they are and assuming that they're creative, resourceful, and whole, it allows us to meet all of these other goals and the agency's goals of the youth having access to things that ensure their health and well-being, housing, education, permanency, employment. All of those get met by making sure that the youth's goals are met. So it's really a shift from the agency's goals and priorities to the youth's goals and priorities, and being confident by focusing on the youth's goals and priorities, the agency stuff will sort itself out and we'll get there. Can we go to the next slide, please?
Pathways intervention flowchart.
What you're seeing on the screen right now is a flow chart that was created in order to provide consistency across sites and navigators in what was happening within the intervention. While I'm not going to dive too deeply into this, you can see there are 3 primary phases of the model. The engagement phase, where the navigator is working with the youth on getting them into the intervention. The actual active phase, where goals are identified and tools are utilized in order to get the youth to where they need to be. And then the phase in which the navigator is working on transitioning the youth to sustainable community supports, and we call that the community transition phase. One thing that I really want to just talk about for a moment as it relates to this flow chart is this is the final draft of a long process. As Lene had talked about earlier in the introduction, she talked about us tweaking and changing as we saw that things weren't working. This flow chart really represents that work and is the result of us working with navigators, sites, getting feedback, revisiting on a monthly basis for, gosh, something like a year, and then eventually getting to this while including youth feedback and focus groups. So there's a lot that went into the creation of this chart to make sure that not only does it work to represent the intervention, but also represents the consistent and good work that our navigators were doing with youth and what youth said they needed themselves. Can we go to the next slide, please?
Typical youth engagement in pathways.
So typical youth engagement in pathways includes all of the things that you're seeing on the screen. So we're doing weekly in-person meetings with their navigators, which in Colorado is substantially different than what you would typically see. Whether it's in the context of a child welfare case or a Chafee case, you would typically see monthly visits with the youth. This is weekly in-person visits with the navigators. This is so important. It's that FaceTime and being there for the youth regularly to help make sure that their goals are still what they want. Are we making the progress that we need to? Youth are empowered to set and achieve their own goals. There are two primary goals that are set as the underlying. And as I alluded to earlier, those goals aren't set by the agency. They're not set by the navigator. They're set by the youth. And then everything else is built on that, allowing the youth to self-advocate for the services they need, when they need them, and how they need them. And creating access to flex funds, which we're going to go into a whole lot more detail on the next slide, in order to make sure that there's money available for the youth to do that. The intervention does use outside referrals. Our navigators don't pretend to be experts in substance abuse treatment or mental health treatment or trauma treatment. They're there to help the youth get their goals met. So we are connecting with all of the things that exist in the local community. In Colorado, we have every version of what's available in the United States. We have urban, rural, we even have some frontier counties. So it's really important to make sure that the navigator can get this model nested within their community. And we do that by connecting with those outside referrals and community resources to make sure we're fitting within the cultural context. Secure, safe, and stable housing is so important. And we were actually able to obtain some housing vouchers in order to do some of this work. And make sure housing was available when other housing wasn't, which was fantastic. Again, where the youth lived was driven by them, as well as working with the youth to achieve the goals that they set and graduate from the pathways intervention using criteria that was created, again, in collaboration with the youth, the navigators, and the sites in general.
Providing small-scale financial assistance.
Slide, please.
Lene Davis.
And Trevor,
Yes.
before you move on, there's been a couple of questions. Sorry to interrupt. A lot of people want to know what's your typical coach to youth ratio, and does the navigator role replace the role of the case manager, or is it a separate position?
Trevor Williams.
So the typical is and I might defer to Lene for the exact number as an average, because she has managed and overseen that, and I'm terrible with memorizing numbers. It's our goal is 10 to 1. So 10 cases to 1. It can go a little bit over that, and that's active youth who are actively engaged in the active phase of the intervention in that flow chart. And no, they do not replace the case manager. They are working with the team that's working with the youth. Now, having said that, as we're going into phase 3, and the summative evaluation, we are implementing it within Chafee programs. So the Chafee worker will be the navigator in sites that are implementing the intervention for the summative evaluation. And our eventual goal down the road, if we collect enough evidence, will be for pathways to be something that is done by Chafee workers throughout the state, if that makes sense, for each of the local programs. But if there's a caseworker involved in a child welfare case, that caseworker remains involved. If there's a runaway and homeless youth case manager involved, that individual would remain involved, and it would be a partnership going through. Thank you, Lene. So flex funds, what are flex funds? I know in Colorado, I can't really speak to anywhere else in the country, but in Colorado, the vast majority of the money that we have available goes to staffing costs and really basic program management costs. Within Pathways, we made sure that there was always a pot of money available for youth to access and for navigators to access on the spot in order to ensure that the needs of the youth are being met. These can be used for all of the different things that you're seeing on the screen. So housing applications, education applications, driver's tests, bikes, car insurance, gas money. Really, what do we need and where are the barriers to helping the youth meet their goals? And if there's a financial barrier to that, we want to clear that barrier relatively fast. I conceptually think about this as creating parity in the way we treat former foster youth as what a typical family might do for their kid who is transitioning to adulthood, or their youth who's transitioning to adulthood. If there are some small financial barriers, let's overcome them. And let's not create massive bureaucratic hurdles to doing that. In some of our sites, our navigators actually have purchasing cards where they actually have a card and they can run it, pay for it, and then provide any documentation and receipts on the back end. So we also assume that all of our staff really are able to do that and responsibly spend that money, of course, with oversight and back end on the administrative side of things. As you can see, about 55% of all of the youth who are enrolled in Pathways utilize flex funds. The average amount used is about $320, and each time is about $46. And the range is anywhere from $1 to $2,000, a little more than $2,000. So there can be, there's a wide range, and that really represents getting there and meeting the youth where they are, and including a set aside of dollars to do that, and saying that making sure that money is available is part of our intervention, not just the staffing costs being part of the intervention. With that, I'm going to go ahead and pass it back to Lene to talk about the most of the rest.
Lene Davis.
Thanks, Trevor. Jennifer had a question that segues very nicely into my next, into this slide. Thank you. How are you selected to participate in this program? So during phase 1, we developed a 12-item screening tool to identify risk factors of homelessness for our foster youth who may be at increased risk of homelessness. We implemented this tool and administered it to all youth who met that target population criteria. We served in phase 2 128 Pathways youth that screened in, and they identified an increased risk, at least one risk factor associated with that increased risk of homelessness. But the average number of risk factors of the youth we served was 4.9 with a median of 5. So half of our youth had 5 or more risk factors identified on that screening tool, half had 5 or less, and the range was from 1 to 10. So you can see that our risk factors, some of the higher, greatest proportion of youth, 66% of our youth used an overnight shelter or received public housing assistance prior to enrolling in Pathways. 56% of our youth experienced homelessness from running away. 45% experienced homelessness because of family violence, and 49% had spent time in jail prior to the age of 18.
Enrolled youth report an average of 9.4 risk factors.
So I talked a little bit about those 5 key outcome areas that we hoped to address or achieve in YARH 1 and 2.
Pathways delivers on the 5 key outcomes.
Our Pathways youth showed improvement in all 5 of our key outcome areas that we measured, which was education, employment, permanency, and health and well-being, and then of course housing. Next slide, please. Our education outcomes improved during Pathways between enrollment and follow-up. So we had a baseline survey and a 12-month post follow-up survey. We saw that our younger youth were graduating high school at higher rates. Our older youth are returning to school at higher rates. And we saw an increase in the percent of youth who were graduating from high school.
A current living arrangement bar chart.
Obviously, a primary goal of Pathways was to reduce or prevent homelessness and create safe and stable housing over the long term for youth aging out of foster care. The evaluation team had several measures of safe and stable housing. We looked at living arrangements, the number of moves in the previous 12 months, and a reduction in literal homelessness. A reduction in unstable housing and homelessness, you can see, went from 37% at baseline down to 10%. Of that 10% who were unstably housed 12 months after the intervention, only one youth was literally homeless, and the remaining were in a shelter, hotel, or couch surfing. We also saw a reduction in the proportion of youth who are living with family, friends in foster or group homes. And we saw a large jump in the number of youth who are living in their own apartment, jumping from 10% at baseline to 51% 12 months following enrollment.
Pathways improves economic security.
The percent of youth unemployed fell 14% from 55% at unemployed at baseline down to 41% at follow-up. And the percent of youth employed either full or part-time at 12 months post-enrollment stood at 59%. Most of those were employed part-time and a quarter of them were full-time. We saw our average monthly incomes, while they were low, we saw them significantly jump for those youth who received pathways. Their average monthly incomes increased by $425 a month from $627 at baseline to over $1,000 per month post. And the percent of youth who had a checking account jumped from 44% at baseline up to 70% at follow-up. And those with a savings account also increased significantly. And then more than half of the youth who participated in Pathways reported feeling very prepared to manage their money following participation in Pathways.
Pathways increases youth connection with supportive adults.
After participating in Pathways, our youth reported an increase in the number of permanent supportive adults in their lives. They also reported an increase in the frequency of monthly contact with those supportive adults. It's important to note that the question we focused on asks youth about supportive adults in their lives that excludes their professionals in their lives, including their navigator.
A healthcare outcomes table.
And then we also saw improvement in health and well-being outcomes for our youth who participated in Pathways. We asked youth at baseline and then again 12 months post-enrollment a series of questions on a readiness for independence scale. One question asked youth how prepared they felt to arrange for their own health care. We saw a 21% jump in that percent of youth reporting that they felt very prepared to arrange for their health care. And we saw a slight reduction in the proportion of youth who report feeling not at all prepared. And then we also asked youth if they had medical coverage. 90% of our youth we spoke with 12 months post-enrollment had medical coverage.
Pathways encourage youth to reach their full potential.
A key component to the work Colorado has done throughout their YARH grants was to incorporate youth voice in every aspect of our project. As part of our phase 2 evaluation, we conducted a series of focus groups with youth to hear their opinions and perceptions of Pathways, and we'll share some of those thoughts. But first, I wanted to turn it over to Christy and Chris. They're going to share their perceptions of the Pathways program from a Navigator perspective and from a youth participant perspective. Christy?
Christy Townsend and Chris Horton.
Thanks, Lene. Hi, everyone. My name is Christy. As I said earlier, I am one of the navigators here in Colorado. As you can see, we are in my office, which is my car. So bear with us. But I have with me Chris. Do you want to introduce yourself again?
Chris, former Pathways youth, as I mentioned before.
And we're just going to kind of go through and ask Chris some questions and get his perspective on his time being in Pathways. I would like to point out that Chris has had 2 navigators, so you know both of us and can speak to maybe how your time has been with both navigators as well. To get started, let's start with how's your experience been with Pathways?
So Pathways, from the start, they were willing to work with me on so many levels. I was at Urban Peak, which is a youth homeless shelter, and Tamisha, who was the Pathways navigator there, I was kicked out of Urban Peak so many times, and she was always willing to help me even when I wasn't there. And that proves to me how much that the Pathways navigators are dedicated to helping the youth, and that they're really wanting to help us get to where we need to be.
Okay. Thank you for sharing and sharing, I guess, kind of things that have happened as well.
Yeah.
what would you say has been the most beneficial thing about Pathways for you?
Housing. I got my first apartment with the voucher about a year and a half ago. I was down in, what is it, North Boulder, I guess you could say. And was there with me the whole year I was at that apartment, helping me figure out stuff like jobs, bank accounts, just all sorts of jazz that I needed help with. We're figuring out things with MHP, which is Mental Health Partners here in Boulder. And then I got my second apartment, and I had a job for like 5 months then, and was really working my way up, trying to get things done. And that was with the help and motivation that Christy through Pathways gave me. And then I got, housing, then I got my second apartment. I've been in it for
6 months?
6 months now, and it's the best apartment I've ever had, brand new in Boulder, which I'm so excited that I could get a chance to live somewhere that was just built and top of the line. So
it's pretty nice, everyone, I will say. Did your navigator from the beginning focus like on your specific goals versus maybe somebody else that I could have been working with her?
Yeah, I mean, of course she has multiple clients, so she has to focus on everybody at the same time as she's focusing on the one person. So,
but did you feel like the goals were really your goals?
Yeah, the goals were my goals. So like, if she was working with me, like one-on-one sessions, we were trying to figure out what I needed to do, how we could implement those things. And then we would we would sometimes go out and get those things done. Like say I needed a bank account, I would get a deposit for that. She would help me with that. And then that's, a lot of the goals were my goals, and she helped me meet a lot of them. So the next part is me getting into school. So
still got goals, which is good. Let's talk about how maybe Pathways has maybe been different than other services that you've had in the past. I mean, without sharing maybe a ton, you've been in the system for, quite a long time. You've experienced some services, and maybe talk about how Pathways for you, has it been different? Has it not been? What have you noticed about your time with Pathways?
So I was in foster care for at least 3 years, and then all of a sudden, like, they just dropped me. So that's the thing, is they kicked me out of foster care. Like, I was unsuccessfully discharged, and then that's how I wound up being homeless. And then they weren't willing to, like, Chafee wasn't willing to work with me as much after that. It was harder to get to Chafee, so I didn't really have that connection with those services. And then Tamisha, I didn't realize Pathways was there for at least a year and a half. So Tamisha finally was like, we have this Pathways program. And ever since then, Pathways has just been dedicated and stuck with me, and didn't drop me like most of the foster care system did. So.
And do you feel like the services, they have been different for you with Pathways?
Yeah, they have definitely been different. Chafee was more like text-based, like learning, whereas Pathways is more of a hands-on learning. You get to learn how to do things by yourself without the guidance, really the guidance from the text, because basically Chafee was all about text-based and how you do it, and just basically the smartness, the book work of it, when really it's like street work. You got to learn by doing it. You can't learn just by text.
Wow. Thank you for sharing. All right, you got a platform of people here. Anything that you would change about Pathways? Anything you think like this could be better about it, for maybe people out there to know for their programs?
I feel like Pathways isn't really like as known as a lot of other programs. Like, say, homeless shelters are more known because they're the ones, like youth homeless shelters, they're the ones that get people through the door trying to get back on the streets. But a lot of foster youth don't know going into homelessness that there is this program. And I think that the thing is, you guys should be more of, like, they should do more like ads, like say foster youth, like Chafee needs to say, like, if there's a homeless person, like, hey, we need to get this person in pathways so that they can develop and grow through that. So like we need more like
marketing.
Yeah. I don't know how to put it, but yeah, there's needs to be like a little bit more marketing towards that side so people know that pathways exists.
I love it. I didn't think of it, and I think it's spot on. Is there anything else that you want to share? Like you again got some people who are listening. Anything that you kind of want to end with on our part?
No, I don't really know, honestly. This is just pathways has just been an amazing, blessed experience, and I want them to continue helping foster youth in transition. So
I don't think I could have said it I any better. So you know, I guess Chris and I will be on for some question and answers if anyone has any specific questions for Chris or myself as a Pathways Navigator and doing this role. I will say I love my job and I love the youth I work with and coming to work, and coming at it from this approach is it's kind of it's freeing, and it makes it open for relationship building, and you know, we can work through hard times with that relationship. So I have been enjoying being a Pathways Navigator. So, and then I think that's it for our question and answers. I think we have another slide. If we want to go to the next one.
Lene Davis.
Hey, Christy, before you finish up, can you talk a little bit about the intervention itself? We're getting some questions from folks around how long does it last? Can you talk about graduation? And you've got a few minutes. So if you want to talk about the intervention itself in general, how you work with the youth and that relationship building piece.
Christy Townsend.
Sure. So first I will say I've been with Pathways for 5 years now, and we have, you know, grown over this time. I think we've really come to see that a good time period is 6 to 12 months. We can get a good amount of work done in that point of time. Some goes longer, some we can do shorter, really depending on those goals that the individual youth has.
Christy's video freezes.
Looks like Christy froze.
Lene Davis.
While we're waiting for her to come back, I don't know, Trevor, there's some questions that are also coming up about the intervention itself, its duration. Can you talk, do you want to talk a little bit about that?
Trevor Williams.
Absolutely. And the freezing is a hazard of having your office be your car.
I'm back.
Oh, she's back. Great.
Okay.
Okay.
She's back.
My phone overheated in my car.
Oh.
The Colorado sunshine for you here.
Christy Townsend.
So if you want me to kind of keep going with a couple more of those things.
Yes.
So I think the relationship building piece is really huge, and it takes a little bit of time. And you saw that in one of the slides that Trevor had talked about with the flow chart. And you can see that it does take, you know, a few weeks, a month or two to really build up that relationship and that engagement building. I will say the flex funds come in handy. We've had lots of Starbucks and coffee trips and ways that we can engage youth, and that flex funds has been very crucial in that beginning engagement time. And then can you remind me, Lene, about another one?
Can you talk about your Navigator training and your coach-like engagement training that you have gone through?
Sure. We have been a part of engaging youth in a coach-like way training for the entire 5 years I've been a part of it. We have yearly retrainings, I guess. I can't think of the correct word. And we also have monthly coaching calls, which are really to support navigators in keeping up to date with the training and what it's really like to go through a coaching session and to use our skills. So I think that that's been really valuable for all navigators, is to keep up to date with those coaching calls because they've been really beneficial.
Lene Davis.
Great.
Yeah.
Another question. Do you have any tips that you can share about engagement? How do you keep youth engaged? It seems, you know, it's a pretty intensive intervention. You're having weekly contacts, especially during COVID in that environment. You know, what's that been like for you?
Christy Townsend.
you know, I think definitely with COVID, it's been a challenge. I think all of us have been feeling it. And when you asked that question, I looked directly at Chris, like, you know, well, how was our engagement? And was it hard? Was it easy? And I think a lot of it is just meeting them where they're at. And again, it's their goals from the beginning. And when you really set it up to that, it's I don't know.
It's pretty easy.
Chris
yeah.
Horton.
When you set it up to the goals that I was at, yeah, it was pretty easy. I mean, yeah, we couldn't really meet as much face to face during COVID, which was difficult, but she did help a lot. A lot of volunteers step up to the plate too, to help with pathways and food, gift cards that I needed during COVID because I didn't have a source of income during COVID. And all that just pushed me to grow even more. So I think that was, it's just more like, even COVID affected everyone. But like, even before COVID, like there was still all that support, all that stuff that you needed. So like that engagement was always there. Like I could call Christy whenever I needed to talk to her about something. And that's part of the engagement, is the ability to access services.
Christy Townsend.
And I would agree 100%. I think, you know, Chris being available, but I also, you know, we set some boundaries, but being able to ask questions and have that trust that I'm going to reply, I think that goes a long way in building engagement. And being there, I think, is just through good times and bad. That's part of our relationship and our relationship building. So Chris and I have been knowing each other for quite a while. Even though he's graduated, we still are able to stay in contact. And I think maybe that was one of your other questions that I saw, Lene, about graduation. Chris graduated during COVID, during COVID in November. And we actually were able to meet outside with his other Navigator and have lunch and really try and make it a graduation. And really, we were just looking at some of those. We have a graduation criteria, which I believe will be included somewhere in this, maybe. But we do have a graduation checklist that I do sit with my supervisor, and I try and sit with my youth, and we look at the goals and talk about the accomplishments, and also leave with some resources. So people, I mean, not just Chris, but he's sitting here with me. He knows who to call if something were to come up, maybe with his housing. So I think that's super important with graduation, is that he knows he can contact me if need be, and he also knows who he can contact for those resources that he may need.
Lene Davis.
A couple more questions. Chris, one for you. What made Christy different from your other case managers or caseworkers or service providers that you've had over the past?
Chris.
I think she was just really, really engaging, and like was like always, like I was at the Source, which is now Together, the homeless shelter here in Boulder, and she would go there every single week and be able to meet with people that were there. And I think that's the thing, is like I never really had that person that was always consistent. People would always leave. I would like stay in foster care. Like I would always have a different caseworker every 6 months, a different therapist every 4 to 5 months. Like it was just not consistent, and I needed that consistency, which was the big difference.
Lene Davis.
And Christy, a question. Thank you, Chris. A question for you. How do you partner or collaborate with other foster care workers or independent living coordinators in your agency? Talk a little bit about partnerships and collaborations, because that is a key component to our pathway success.
Christy Townsend.
Sure. I do think our transition age youth team, that is our team at the county, already has a pretty good rapport with our caseworkers, which comes from, I think, doing good work and showing up and being at meetings and being consistent, maybe really similar to what Chris is saying, and really proving that this works. I will say, I do think it took, I don't remember exactly how long, maybe Lene would remember, but it took a good 6 months, maybe a year, for caseworkers to really see the outcomes and see the difference. And I think that was a big turning factor for people to actually see for their own eyes that this works. And also building that relationship with the caseworker. I'd like to think every caseworker that I've had the opportunity to work with, they feel like they can call me and reach out, and vice versa. So I think that relationship building piece is also big with them.
Lene Davis.
Great, thank you. You want to jump back to that last slide that you're going to take?
Christy.
Yes.
Next, a slide titled Pathways is Uniquely Youth-Led features a pyramid graph from bottom to top, establishing goals, skill building, and
so
direct
this is
support.
just for everyone to see a really good visual about maybe in how we approach working with youth. And I think, you know, the biggest thing we do is trying to establish those goals in the beginning, and that is done through that engagement process. I mean, because you're really wanting to learn about the youth during this engagement process and what makes them happy, what gives them spark, what is it about, you know, life that's so that they could be excited about in some way, shape, or form, because it is different for every youth. So we start with establishing those goals. And again, this could be so different for every youth. It's not always just housing. I had one young lady who wanted to change her name, and that was a very big goal of hers. And we spent quite a bit of time working on that goal. And through that, I think we then do the skill building. That's when we are calling landlords together and filling out resumes together and going to doctor's appointments together and everything. Social security, yeah. I mean, I think we all know kind of there, the list could go on. And again, it's doing it with the youth and being able to have that weekly appointments allows us to be able to have that time to do that skill building. And then lastly, the direct support. I think every youth that I have thought about housing, I have helped move furniture into their apartment, and really doing that direct work is the piece that helps, I think, with the end piece and the graduation, for them to feel like they can kind of do this on their own from here on out. So yeah, that's, I think, that slide, and I think that's it. And I will pass it along to, I think, Lene.
Thank you, Christy.
Lene Davis.
So that concludes our presentation. And if you want to go to the next slide, you know, there's been a lot of questions in the Q&A. I think we have a few minutes left if you want to ask any more questions.
Closing remarks and Q&A.
But there's been questions about resources available. So as I mentioned before, there's a YARH project page on the OPRI, Office of Planning, Research, and Evaluation's website that contains a lot of products that have been developed over phase 1 and phase 2. And it's also where you'll find those when we publish the new project specific resources, they'll go on this page as well. And then additionally, the Center for Policy Research has a Pathways to Success specific website that you can go and learn more information about the Pathways to Success project. The intervention manual is on our website. You can download that, and that's going to talk about the coaching. I know there's been some questions about how the navigators are trained, and it goes into some detail about that coach-like engagement training model. And then the phase 2 research findings that I just went over are also in a final report on that page and in a research brief.
For questions related to Colorado's Pathways to Success, Trevor Williams, trevor.williams@state.co.us, Lene Davis, Ellie Davis at centerforpolicyresearch.org. For general YARH questions, Mary Mugenborg, mary.mugenborg@acf.hhs.gov, Catherine Heath, catherine.heath@acf.hhs.gov, Kay Bradley, C. Bradley at mathematica-mpr.com. Next, Christy Townsend.
Yeah, so during COVID was definitely tough. I will say we had a really great support system here in Boulder County. We had a volunteer who was able to collect food through her community, and we were able to drop off boxes weekly to our youth, not just in Pathways program, but through all of our Chafee and independent living services. All of our youth were weekly given food boxes. We also did phone calls, video chats. I mean, we were standing, I remember one point Chris was standing on the 3rd floor of his apartment and I'm on the 1st floor, just dropped the box off, and we're doing our check-in outside, at a safe distance. So I think we were just trying to be creative with whatever we could. We are now a lot of us on our team are slowly becoming vaccinated, which has been great. And I think we're just all trying to do the best we can during these times. And I think we know that texting has also been like 100% a great way to keep in contact. So yeah, I will leave it at that.
Trevor Williams.
So thank you very much, Christy. There have been a number of questions in the chat about administrative stuff, availability of the intervention, and a couple of questions about extended foster care in Colorado and how and what that looks like. The easiest question to answer is the availability of the intervention piece of things. Right now, it's only available in Colorado, and at that, only in some Chafee programs. We are getting ready to start a summative evaluation. So about half of the Chafee programs in Colorado will be operating Pathways programs, and the other half not, so that we have a comparison group. All of them will have access to independent living and Chafee services, but only half will have access to Pathways. In terms of administration of funding and even extended foster care, it's important to note that Colorado is a state supervised, county administered state. So we have 64 counties with a couple of collaboratives. So we have something like 62 different ways of implementing child welfare services in Colorado. And we really had to respect that as we were implementing Pathways. As I had mentioned before, it's designed to fit within a number of different areas. And that's because we have to fit within those independent county cultures and make sure we're respecting their autonomy. We allocated money to sites for flex funds throughout phase 2 based on what they needed and what they were demonstrating need for. And as far as administration went, we really left that to the supervisors largely to oversee the utilization of flex funds while making myself and Lene available to answer technical assistance questions. Like I said earlier, the flex funds, the key to the flex funds was making them available quickly without having to jump through a whole bunch of administrative and bureaucratic hurdles. So they are required to keep receipts and things along those lines for backup. But we really did everything we could to remove administrative hurdles. Extended foster care in Colorado. So extended foster care is available in Colorado. We have had a continuing jurisdiction statute in our state since the 1970s, but we formally opted into Title 4E extended foster care, I believe in 2018 was when our plan was approved to start engaging in the Title 4E program. Right now, our average age of exit from foster care is about 18 years and 4 months. We do not, Division X created reentry, but we were already working on legislation to allow reentry, and currently we have legislation pending before the Colorado legislature, House Bill 21-1094, that would create a formal structure of reentry in Colorado, as well as adding a Chafee-like program that would be a grant program that will run alongside Chafee, the federal Chafee program, to ensure that there's funding, adequate funding for an evidence-based program like Pathways throughout the state to create sustainability. It's a working, growing situation here in Colorado that we're very excited to be working through right now. I think I can, at this point, with 2 minutes, I think 2 minutes left, I think it's about time to close.
Lene Davis.
Catherine, did you have, I think Catherine was going to share a little information.
Mm-hmm.
Text on a slide states, "Thank you for attending. We invite you to join future webinars to continue learning about YARH2 grantees." Now, Catherine Heath.
Thank you so much. I just wanted to reiterate that subscribing to the email allows you to get a couple of our briefs that are upcoming. We've got some information about housing resources and utilizing vouchers for young people. Colorado is a part of writing this brief. We also have another one on youth engagement. And just to reiterate again, This was one-time funding that we were able to offer child welfare agencies and other community organizations to really look at building the evidence. And this has been 10 years in the making, so that we're just really thrilled that we could continue to partner with Colorado. So with that, I'm going to turn it over to Jen to close us out, and thank you guys so much.
Jen Vidrine.
Thanks, Catherine, and the entire Colorado team. To everyone who joined, thank you again. We've had a really good discussion today. As a reminder, we will be sending out a follow-up email with this presentation, as well as some of the materials that have been mentioned, to stay up to date, like Catherine mentioned, about everything that we're releasing related to this webinar series. Please to hit the subscribe, check out the subscribe URL in the chat. It'll also be in the email that we send out following this presentation. So we'll be closing now, but thank you again for attending.